Hello, welcome. I'm Dr. Bird with Chiro4health, your neighborhood chiropractor. I want this to be one of those events or moments in your life when you actually stop and think and realize the reality of what's going on in healthcare in America. Think of these names: Heath Ledger, Michael Jackson, Brittany Murphy. This is all within a short time period. Why is it that so many people are overdosing and having problems with drugs? And why are we as a nation utilizing so many drugs and even looking for the opportunity to spend more on drugs? Let's think about Vioxx. How many people died from that before it was actually taken from the market? There's things as a consumer that you really need to be aware of, and at some point during this interchange here, you may very well be annoyed that you're having to get this information from me. What stories have you experienced in your life from medical neglect or dissatisfaction? Have you or your family ever had a death caused by MDs or from medical mistakes? And if you have, do you really think that you would be able to notice that, or would they conceal it? This is one of those moments that actually, if you let it, it will actually change the way you think, the way you see your news, the way you see a lot of things. So let me walk you through this journey, and we'll see what we can find out together. Okay. Right now, the current health care should really be called disease care. And the reason why is you don't go to a hospital, you don't go to a medical doctor, you don't go to most of your healthcare physicians unless you're sick. So from now on, let's just call it disease care. And anytime you hear healthcare in the news, I want you to kind of think about that. I want it to grab you. Right now, the healthcare or disease care is an outside-in model, meaning that we put things into the body to change the body's physiology to create a change. So say someone has a temperature, what do? We take it down. All of this reasoning implies that man is smarter than the body. The body doesn't know how to have a high temperature. Oh, it can't know that, so let's lower it with drugs, okay? This type of rationale has been advocated heavily by pharmaceutical industries. They want you thinking like this. It's very common in our culture to know things like this. If I have a headache this big, what's it got written on it? Okay, etc. That's right. Here we have some product placement over here in a car. Does this look like healthcare or a commercial? Okay. Plop, plop, fizz, fizz. Oh, what relief it is. Who knows that? Okay. Alka-Seltzer. Meanwhile, we haven't really talked or told people how to eat. We just tell them, hey, if your stomach hurts, take something to make it quit hurting. If I have an itchy, stuffy head, so I can rest medicine. Okay, we all know that. What's interesting is we can get 30 people in a room from all over the country within the last 10 years, and somehow they migrated to this area, and they all know this because these commercials have been running for so long. It's inside of our psychology. It's in our head. A child with a fever, what do they usually get? Okay, Tylenol. That's right. Okay. And I really want you to think about this. Why are we lowering the fever? Is it really the fever that was killing the rheumatic fever children back in the early part of the century? No. It could have been the presence of disease. Even pharmacists today will say they don't really know the answer to that. So there's some things we really need to talk about and think about. Right now, all of the pharmaceutical industries have a huge influence on the way people think, the way doctors think. And let me just start off by saying this. I'm not anti-medicine. There is absolutely a time for medicine, and I am a chiropractor. I have friends that are MDs, and they're as fed up with it as I am with people walking into their practices saying, oh, I saw this commercial and I want this drug. Okay? So this is a very widespread problem, and it's not only within the chiropractic profession are we sick of it, even the MDs are getting sick of it these days. But what's happening is you have pharmaceuticals through grants, donations, and research funding giving money to universities. Okay. Now, an ABC News report said that when a drug company funded a study, there was a 90% chance that that study was going to be found effective. Okay. If you're a school getting millions of dollars to find something, don't you think it's going to benefit the company that's financing that study for you to find something positive in their favor? This happens every day. A non-drug company funding study only happens 50% of the time. So right now we know 40% of the so-called science out there on the market is something that was bought. Okay? Why is it you're hearing that from me? Why aren't you talking about it on the news? Okay? Wall Street Journal in 1996, Tainted Truth, The Manipulation of American Fact, found that in 1981, the drug industry gave $292 million to universities. $292 million. By 1991, it was $2.1 billion. Okay, this is a significant amount of money. And this money can be used to change the way people think and change curriculums. Okay. Not only do pharmaceuticals give money through research, donations, and grants to schools, they also influence doctors by sending them on trips to educate them about their products. Okay. They spend $19 billion a year on that, and have over 314,000 events attended by doctors. If I'm a doctor and I go to Tahiti for the weekend to learn about a drug, what are the chances of me prescribing that drug when I get back in my office? Okay, you really need to start thinking about this when you go to an MD's office. More so than that, direct-to-consumer marketing in 1996 really took off in America, and this is the time when you saw a lot of change from a lot of your news programming commercials went more towards pharmaceuticals. We are one of 3 countries in the world that even allow pharmaceuticals to advertise to the consumer. And again, MDs are frustrated too. They're not always the bad guy. I'm definitely not picking them as the bad guy here. But $11.4 billion was paid to direct consumer marketing. This happens in Australia, and I'm not sure the other country, and there's the only 2 industrialized nations in the world that allow that. Okay? So every time you see a news segment with a drug commercial on it, I want you to really start to think and see that for what it is. It's disease care and the marketing of product. Okay? Now, lack of consumer awareness today. The average American family, all right, has 29 different drugs in their household. 51% of us or more take, or 51% of us a day takes 1 or more drugs. Okay? We teach our children that that drugs are the solution to everything. If they're hot, if they're depressed, if they're infected, if they're anxious, if they're bored, there's an over-the-counter medication or prescription for everything. We are a drug-infested culture. Make a note, there's a big drug problem with kids right now. 65% of teens get their drugs for non-therapeutic reasons at no cost out of their mother's and father's medicine cabinet. Okay? So who are you? What kind of drugs do you have in your household? And what are you promoting? What kind of an idea are you promoting? Non-steroidal anti-inflammatory drugs, they kill 16,687 people a year and account for 80% of all ulcer-related deaths. Why is it that you're just now hearing this? I want you to think about this. Okay. Disease care today. Also, the number of antibiotics given for a viral infection in this year is 20 million a year. So that's 20 million doctor visits where you walk in, oh, we're not really sure what's wrong with your kid, we think it's a virus, but let's just give them a bacteria or a antibiotic just in case. Okay? There should be no just in cases. They should know. Because in the instance of it just in case, let's say that there's not a bacteria, but now there's the antibiotic in the body, but that antibiotic gets exposed to another bacteria, and that bacteria kind of mutates and doesn't die from it. Now you see the emergence of superbugs that are antibacterial resistant in society. Every time you take an antibiotic, you have to think, what are you doing to the germ population? You're exposing it, and therefore you're making it stronger. So if you know someone else taking antibiotics, and it's not for sure that they have a bacterial infection, you need to have them think about it, because it's affecting your health and your family's also. 96% of children with ear infections in the U.S. receive antibiotics. It's only 6% in Europe. Okay? Why is this happening in America? Aren't we supposed to be this great country that knows all this stuff, has the greatest scientific stuff? Each year, drug-related problems account for 41% of all hospital admissions. 41%. While America represents 5% of the world's population, we consume 65% of all the drugs produced in the world. That's us. That's you and that's your family. Okay, I'm trying to show you a way out of that. Death by Medicine, Life Extension Magazine published this article, and this article was not written by chiropractors, it was actually written by PhDs, MDs, nurse doctors, and several of each. Okay? Up until this point in time, no one had ever taken, in our scientific community, well researched, no one had ever taken the number of deaths that occur from medical mistakes every year. Okay? This article did this in Life Extension Magazine. There's a link, a PDF link on this page that says adverse drug reactions. That's one study, and then we're going to try and get all these other studies up there also. Under this one study, it was done by JAMA, and it was done from 1966 to 1996. So this is not a 2-week study. This is a 30-year study in hospitals. What they found that, on average, between 98,000 and 137 deaths occurred in hospitals every year from people taking the right amount of drug without administration failure, without overdose, the right amount that was prescribed by their doctor in the hospital setting. They agreed that 106,000 people a year on average die from that. This is JAMA that's saying that. These are also peer-reviewed articles, all of these. Okay, so here we have medical errors account for 98,000 deaths, bed sores, which should be preventative, infections, 88,000 deaths a year. Nosocomial is a term that means if you go into a hospital without one diagnosis and get that diagnosis as a result of being in the hospital, like an infection, okay? 88,000 people a year go to the hospital without an infection. They get an infection in the hospital and they die, okay? Malnutrition in hospitals, 108,000, okay? Outpatients, another 199,000. Unnecessary procedures, surgery-related accidents. This totals 783,936 deaths a year from medical mistakes. Do you know how many people that is? Have you ever thought of that? Why are you getting that news right here from me? This should be widespread, okay? West Nile virus, everybody's heard of that. It's caused 209 deaths, okay? Swine flu, bird flu. Why are those getting so much attention while this is not? Okay? Some say that they're prepping the market for vaccines for these things. I don't know. There are always going to be people that die from the flu, and it's an unfortunate thing. Usually it's going to be your immunocompromised people. But let's look at the bigger picture here. Okay? Death by medicine. What they found was the American medical system is the leading cause of death in the U.S. Cancer in 2001 was 553,000. Heart disease in 2001 was 699,000. And deaths per year from medical mistakes was 783,936. Yes, this is equivalent to 1, 2, 3, 4, 5, 6 jumbo jets falling out of the sky every day. If the airline industry had that record, would we still use them as a primary mode of transportation? Why are we using healthcare or disease care that we know as our primary mode of health right now? You really need to think about this. It's your life that's involved. Okay. Even though we have the highest, finest medical care in the world, we have the best trained MDs in the world, we have more hospitals than any other country in the world, we have the best equipped hospitals in any other country in the world, we have more medical discoveries every year than any country in the world. With all this said, we should be the healthiest, right? In industrialized nations, we are 39th in general health, 23rd in infant mortality, and 24th in maternal mortality, okay? Here's the big thing. 3 out of 5 geriatric patients are in the hospital because of misuse and overuse of medication. 3 out of 5. Think of the system or the thought process that they were raised in. If I have a headache, I take a drug. If I have an upset stomach, I drink a potion, okay? We really need to start thinking about this, okay? It is time for a change, and that's what we're going to do in the next segment. Thank you for being with us, and we'll see you in a second.